morning, everyone, and welcome to CertaPay's Coffee Break. We are so glad you're joining us this morning. I am Rachel Kamala, your host, and I'm here with Cindy Merkel from our HR team. She is our moderator. We also have some other members of the CertaPay team on this morning. Shout out to Claire and to Sarah Ardman, our marketing coordinator. We're so glad everybody's here. We hope we're helping you with these questions and answers. And as always, if you have more questions that we don't get to and you'd like to hear them on one of our coffee breaks, send it over to us and we'll create a coffee break that addresses those issues in particular. So let's get rolling. Today we're talking about summer travel and how those intricacies fit into COVID-19 and issues and testing and policies and anything that goes with that. So the thing is, now we're at summertime where normally people would be taking vacations. Only this year is a little bit different. So people may have changed their summer plans, or people may be thinking now, okay, we're relaxing our guidelines a little bit. I think I'm going to go ahead and visit my family member in another state, or I'm going to go take a little bit of a summer getaway and see how that goes. So the CDC makes recommendations. The CDC doesn't issue mandatory guidance. That comes from the government agencies. So your state, local, federal, all of these government bodies issue the mandatory guidelines or the orders that we're following during this time period. What the CDC does is make recommendations based on health and safety. So the CDC is actually saying, you know, please guys, maybe stay home this summer, don't travel all over the place. And so then our government bodies take that information and make decisions based on that, especially on a state-by-state basis, because things are different in each state. So that's kind of the overview of that. And the CDC also says, okay, if you do travel, just practice social distance and cleanliness, washing your hands, using protective gear and equipment, masks, and whatnot. So if you are traveling, practice social distance, use safe hygiene practices. And they also specifically say, understand what your state's guidelines are and follow those. And that's kind of the overview that will keep you safe as a business owner and a business leader. So, and we know that our employers have the best intentions. And some people are saying, okay, what if I just make a mandatory policy? If you travel, then you have a mandatory quarantine. Well, the first answer is you are allowed to do that. But the longer answer is be careful about doing that, because this will be something that, first of all, it's going to probably change. And so you don't want to spend time making this whole elaborate policy when you know it's probably not going to last that long and you'll have to change it anyway. And in addition, this kind of policy will be really hard for you to administer, because you may or may not know if somebody travels beyond state lines. You may or may not know if somebody went away for the weekend and came back, or if somebody tells you they're going on vacation, they may not tell you where they're going. So you have a whole group of people who may not give you all of the information. And then, can you follow this policy yourself? What are you doing this summer? Are you going to be traveling? Can you make a policy like this and then follow it yourself and then track all of these people? It's almost giving yourself more of a headache than it's worth. But having said that, you are allowed. You could say that if you travel, then you have to quarantine for 14 days when you come back. But knowing, you know, what it's going to take to follow that, let's say you still want to do it anyway, be consistent. If you make that policy, it applies to every single person, including you. And then the other piece of that is make sure everybody is aware of it and understands all of the components to your policy before they go anywhere. Don't make this policy and not really tell anybody and then have them come back from vacation and you say, oh, but. So be upfront, be clear, inform everybody, be consistent, or really think about if it even works for you. So maybe instead, you can create policies that are an alternative to that. So not necessarily a full quarantine, but take a look at your state guidelines. Your state will give you some guidance on what you need to do. And so maybe you're not carving out a set policy, but what you're saying to the employees is, hey guys, we're in changing times, and each day we may take a different approach to travel and vacations and going to visiting different states. So as long as everybody's aware, you're up on it, you're following it, you know there are some different things happening, and then take the stance of, we're going to be very careful about social distancing, we're going to be very careful about protective gear, and we're going to be very careful about understanding the hotspots. You know, the virus hotspots are different every morning when you wake up. So be aware of what your state's guidelines are and what your state policies are with regard to the current situation. And being consistent will be very important. And so I talk about your state's guidelines because under the FFCRA, the paid leave is very clear. The FFCRA is for an individual employee. So in the beginning, when this started, people said, well, our business was ordered to close by a state mandate. That's not the same. So if an entire business is ordered to close, that doesn't fall under paid leave. However, this does. So if a state says they are mandating that anyone who travels to New York, New Jersey, Louisiana has to self-quarantine for 14 days upon return. Now, this is line number 1 under the FFCRA. An individual employee who traveled beyond state lines to one of the states where they're issuing a mandatory quarantine now is subject to federal, state, local quarantine or isolation. This is line number 1. So that individual will qualify for full pay up to 80 hours if they haven't already used it, and at that 511 cap. So something to think about. Let's say I've got an employee who goes to New Orleans for the weekend, and then when they return, Florida says anyone who travels to Louisiana must self-quarantine for 14 days. That individual employee now qualifies for paid leave under FFCRA. So now you have to take a look at, has this employee used any previous leave? If yes, then you don't have to pay them for the leave, but they do need to quarantine. So they cannot come into your facility. So you want to think about some different plans. Can they work from home? Go through the steps that we've talked about before. Can you still have this employee do work while they are self-quarantining? Do they have time available? All these questions are things that you want to think about if you have this situation come up. Now let's say the same example. The employee travels to Vermont, a state where we know they aren't having people self-quarantine, and then they come back from their vacation, they can return to work as normal, no issues. Or let's say they come back and they say, I don't feel comfortable working because I may have been exposed to somebody, passing them in my travels. Well, that does not qualify under reason number 1. They have not been told by a governing body or a healthcare provider to self-quarantine. So in that example, the employee just doesn't get paid if they don't come to work. So a lot of things to consider, but the understanding your state guidelines are very important during these times. Now, I think it's important to bring up work travel versus vacation travel or personal travel, because if you're asking your employees to work on your behalf and travel is involved in that, and now as a result of that travel, your employee tests positive, comes down with symptoms and tests positive for COVID, you may be looking at a work comp situation. So another thing to think about, when you have employees who travel as part of their job description and part of the work they do, you want to have policies that protect your employees during that travel. Or perhaps they don't travel just yet, or you look at the locations of where they would be traveling to and from. So pay attention to that right now if you have employees who work and cross state lines during this time frame. So just to kind of wrap it up, keep in mind that FFCRA, that paid leave, is still in place. It's in place all year. And now we might get a situation where people have used all of their leave available and may have an issue where they have to self-quarantine according to state guidelines. So that'll be something you want to think about. Or you may have used some of the leave and you have to figure out how much is available to them. And that is in place all year. Those are average hours worked is what falls under that coverage, and average pay. So the amount you pay them is based on a 6-month look back of the wages earned, including tips, commissions, all of those pieces. And also, if somebody works for you 30 hours a week, then their max would be 60 hours, 30 in each week for a total of 60. Now, the other thing is if you have employees who have used that first 80 hours of leave as a result of childcare situations, so the schools were closed, they had to use those 80 hours of partial pay while they were caring for a child whose school was closed or daycare provider was closed or childcare provider was not available, those people would not have time available. So if they then traveled during summer vacation and came back and were subject to that 14-day quarantine by state guidance, then they would not be eligible for paid leave if they already used those 80 hours for childcare. So there are a lot of layers you want to think about. Work travel can cross over to the work comp issue. So think about that and have some safety guidelines in place to protect your employees. And be consistent. Not only consistent, but flexible. These guidelines are changing all the time. This information is as of today, and it's probably going to change again tomorrow, the next day, and the day after that. So be consistent, but be flexible. Our only constant right now is that we are constantly changing. So keep that in mind and be ready to change again. It's okay. And we will be here to support you in that and help you with the decisions of getting through it. So short and sweet, I'd like to open it up to some questions now.
I do not have any in the chat box, so I don't know, Rachel, if you want to open it up via the microphone or if you would just prefer them to put them in the box and let me read them.
I do see one in there. Employee travels to New York. With that, upon return, they do not want to quarantine, although it is required. Are we to restrict them? You know, it's kind of a good question. They don't want to quarantine, but it's not a question of do you want to or not. That's a state mandate. You know, if they're coming from one of the places where the state of Florida says, if you travel to this state, you must quarantine for 14 days, it's not up to them to say, no, thanks, I don't want to. So, yes, they have to self-quarantine. So what you can do is figure out a way to keep them working. If they can work from home, that's fine. But that person would not be permitted to come into the building for 14 days. They would need to quarantine. And then I see the question about Canada and Puerto Rico. I think Puerto Rico is on the self-quarantine list, but again, depends on where you are. You want to check your state guidelines on that and see what you would need to do to follow your own state's guidelines. It will be different per state, depending on where you are. The international travel requirements are the same thing. So mostly right now it's other countries have a quarantine from us, but you know, check the guidelines and see if there are limitations for international travel. I know Jamaica, Brazil, there are some places where we definitely have a 14-day quarantine upon return in place. So we want to check on that. Here's a question from Angela. If out of season, an employee is scheduled 32 hours a week, does the 6-month look back apply? Yes, so you would take a 6-month snapshot and get an average of the amount of hours during that whole time frame. Got another big question in here. Cindy, can you see that one? How would you
I
handle
can.
this? We're in California. We have 5 to 6 employees that would be working daily in a facility. All of the other employees are remote. Now the remote employees are starting to go to different states for vacation. Not a current hotspot, but when they return, they will start coming to the facility. Okay, how do we handle protecting those that have already been working daily in the facility, not knowing the employees who've been around the whole time? Okay, so it's a good question. And same thing, either when those remote employees return, if they've come from a state where California mandates a 14-day quarantine, then have them continue working from home, have them continue working remotely through that 14-day window. And then once you bring them into the facility to return to the facility for work, just practice your normal safe practices and social distancing as you are in the facility. So just get them through that 14-day window. If they haven't traveled to a state where you've got a mandate there, then they should be okay to return to your facility. And what are your practices about safety and social distance in your building? That's what you want to take a look at.
Okay, I can see the rest of the questions now, Rachel. The next question is, what if they're a new employee with and only being employed a month or so? How does the look back apply to them?
Okay, if they're a new employee, then you use the data you have. So keep in mind with, you use the data you have based on the number of hours that they're supposed to work. And with the FFCRA, that first 80 hours of paid leave, it doesn't matter how long they've been employed. So a brand new employee could be eligible for those 80 hours of pay. Somebody who maybe only worked for you for 1 week, then they went out of state on the weekend, and then went to a state that is subject to a 14-day quarantine upon return, they would be eligible for that regular pay that you've been giving them for the regular amount of hours per week. So that's a good question. Now, the additional, I'll just throw this out there, it's not really pertaining to travel, but the additional 10 weeks of child care under FFCRA, you have to be employed for at least 30 days before that kicks in.
I have no other questions.
Here's the one about, I don't know, it's funny that we're getting different questions.
I think they're coming privately, that's why.
Oh, okay. If an employee uses partial pay for childcare and is paid 2/3 of his pay, then ordered to quarantine for the virus himself, is he entitled to the third pay not used for childcare and the balance of the full 80 hours? Okay, this is a great question. It's super intricate and has applied to a lot of people. So the number of hours is fixed. Let's say I have an employee who was immediately impacted by the child care situation, and they used all 80 hours. We paid that employee 2/3 pay for the entire 80-hour window, and then the employee returned to work, figured out child care plans, whatnot, and then came down with the virus. So now affecting themselves, they have already used that 80-hour window. There is no pay available. They do not get the 1/3 difference. The hours have been spent on something already under that guideline. So once the hours are spent, there are no more. It doesn't matter how they got paid, at 2/3 pay or full pay, the hours have been spent. Now, let me throw in a different example. Let's say you have an employee who is out because of the child care, and they would normally be entitled to the full 80 hours of pay. And after the first week, come down with the virus and test positive. Now it applies to themselves. So for the remaining 40 hours, you switch from 2/3 pay to full pay. That's a case where you would just switch your pay category, but you don't increase your number of hours. The hours are fixed. Okay, then
I can.
You see that it will be an average for the past 24 weeks for the day the employee was sent home. It'll be an average. Right. Exactly. So you take that look back period of 6 months from the date of the request.
I think we're back on track, so let me know when you're ready.
Okay, I see the one from 1148. What if it's a new employee? Okay, we answered that. Good. Okay, do you want to jump in, 1151? I think we're getting there.
No problem. Yeah, we're back on track. An example, an employee can go on vacation to a state they know is not allowed. They go anyway. We have to pay them for their vacation, their PTO time, and then 2 weeks of quarantine. Does the FFCRA apply here, even if we're an essential business?
Yeah, so the travel, it's true. They can go on vacation, and it's not that a state is not allowed. It's just that there are precautions when you go to a state and then return. And so it doesn't matter if it's a work trip or a non-work trip or, purely social, visiting. It doesn't matter why they're going to the state. When they return, they are subject to that self-quarantine. And so, yes, FFCRA would apply. That would mean that person went on vacation. Let's say they were out for a week. They had paid time off based on your company's vacation policy, and they used that for the week. And then when they returned, because they went to a state where your state says this, if you travel to this state, you're subject to quarantine upon return. So now they come back and they need to self-quarantine for 14 days. If they have not already used their 80-hour allotment of FFCRA, then that is what applies. And you would pay them under that FFCRA leave policy, and then you would get the credit for that on your payroll taxes on your quarterly 941. So because that's part of the FFCRA program.
Okay, next question. If an employee calls out sick and says they think they have COVID, they don't go for a test for a week, and then they test negative, do they get any COVID pay?
Well, so a couple of things here. If somebody has symptoms and they are seeking medical attention, then that qualifies. So yes, they would get paid under the FFCRA. And having a negative test result is actually a good thing, because what that means is you can get them back sooner. So now that you know they've got a negative test, you maybe paid them for the first week while they were waiting for the test, but they sought medical attention from somebody. Maybe they called their teledoc. Teledoc said, go down and get the test. And so they were home waiting and burned through their cold or flu, whatever it was. Now they're symptom-free. The test came back negative. They can come back to work. So communication is an important piece here. You want to talk to the employee, see what's going on. And when the FFCRA applies, when that paid leave applies, you want to remember that you do get to claim that credit against your payroll taxes. So you will get that money back when you subtract it from your 941. I also want to remind everybody that we have some great forms, and we have an excellent form for the FFCRA, and it has which reason they are going to need the leave for, if it is a state mandate, if it was because they have symptoms, if it's childcare, and then it also has some touch points. So you're not necessarily asking them to give you backup. You're not sending them to go get you proof or anything, but you are asking them questions. What doctor did you speak with? What was the date? What did they tell you? Where did you travel to? What were the dates of your travel? So you're going to have that information listed on the form. And then most importantly, the employee is going to acknowledge that the information they're providing is true. So when they sign that form, and again, if they are out on quarantine, you don't want to have them come in to sign your form. We have a fillable form you send electronically, and they can sign it electronically, and then you keep that for your backup. But getting that acknowledgement that the employee is being truthful is important as well.
As a follow-up to that, the question is, but can they only use 40 hours and then use the second 40 if they come down positive later?
Yes, so it's a total. Originally, it was supposed to be used consecutively, but then we had situations like this where maybe somebody had symptoms and then they test negative, and so they're coming back to work, but then 2 months later, they have symptoms again. Now they're out again. They're going to be tested and they're positive. So you can use the remainder of what you haven't used. And same thing in that 80-hour window. Let's say I've got an employee who is out sick and tests positive, but really only ended up using a 40-hour window, then return to work, symptom-free. But now later they have a childcare issue as a result of COVID-19. Now they've got 40 hours remaining in that 80-hour bunch to apply towards childcare at 2/3 pay. So you can kind of mix it up a little bit when you need to, but the idea behind those 80 hours for sick pay is that you're using it consecutively, but there are cases where it can be broken up.
Okay, the next question, they're asking if we could do a webinar with the types of forms we've created, maybe present some examples. We did do that last week. I'd be more than happy when I get the email list at the end of the day to send the situational one that we did last week in addition to this presentation, as well as the forms that we've created internally. So to answer your question, yes, I can make sure you have that.
Absolutely, and we'll send you any forms you guys need. I wanted to go back. I see Stephanie asked about the CDC recommends quarantining after travel. So I just wanted to go back to that. The CDC makes recommendations. The states mandate. There's a difference. Just because the CDC says these are our recommendations that we suggest you do and follow, that does not automatically qualify for paid leave under FFCRA. You want to pay attention to specific state guidelines and guidance that comes from state, local, and federal government bodies. So if somebody travels to a state where your state says, if you went to this state, you must self-quarantine for 14 days, that's when it applies. And no, a negative test does not get you out of that 14-day window in that case. You would have to go through the full 14-day quarantine before that individual could return to work. Now, let's say the CDC recommends quarantining after travel, regardless of where you go. Those just don't automatically qualify for FFCRA. So you're not held to maintaining a quarantine. So if somebody goes to a state where they aren't, it isn't a mandatory quarantine, and they have no symptoms, then there's no reason they shouldn't return to work under that example.
And also a follow-up to the forms, I saw Claire's comment. We are working on having them translated to Spanish, so there's no miscommunication as far as what we're asking the folks from their health perspective of how they're feeling and things of that nature. Okay, I'm going to move on to the next question. It says, if the CDC recommends quarantining after travel, can an employee instead take a test and provide a negative result to return early? That's a great question.
That's the one I just covered.
Oh, I wasn't paying attention. I'm sorry. I was typing. All right, moving on. If an employee is feeling symptoms and sent home to do the test and he works with a group of employees, do I need to send them all home to quarantine, even if they are not feeling any symptoms?
So another great question. And, there's a lot of information out there. The CDC says send everybody home, quarantine, do that. But that's the CDC's recommendation. It doesn't mean that's exactly what you have to do. What you want to do is break it down. How close did the individuals work with each other? How long was the potential exposure? And just because somebody has symptoms and is sent home doesn't mean they're positive. So what I would say is you have to really break down these examples. Somebody has symptoms, obviously they need to go home, maybe seek some medical attention, get a test of their own, and give you some feedback, give you some information about that. Look at your safe practices and your social distancing. Does everybody have protective gear and equipment? So if you had people in a group working together, spread out outside or in a facility where they have social distance, but everybody's wearing protective equipment, then you should continue those practices and pay attention. If anybody has symptoms, ask them to communicate with that with you. And we also have a questionnaire that is great. At the start of each individual's shift, you might have a series of questions. Ask the questions. Have you been running a fever? Do you have any symptoms? Have you had a cough? Do you have a sore throat? Do you have any of the symptoms that could potentially mean COVID-19? And in those cases, those individuals should stay home. So communication and information is important to help you get through that. And those scenarios are going to be a little bit different.
This next one is more of a suggestion. I'm going to read it anyway. For the next coffee break, maybe discuss handling employees who were furloughed, now refusing to return to work, have employer benefits, how to separate them, when to separate them, and how to handle all the paperwork. So we will go ahead and dive and take a look into that as far as it. Go ahead, Rach.
Yeah, okay. Yeah, I was just looking at that question too.
Okay.
And then I see one from Laura. Is there a specific allocation in payroll for FFCRA credit, or is there a separate form? So this is actually two questions there. In payroll, you have codes for FFCRA, and it's C19 P for partial pay and C19 FP for full pay. So when you have employees out for those specific reasons, the hours should be coded with those codes. And then when we prepare your 941, or when you're preparing your 941, you can pull reports that show which hours are applied to those codes.
Next question. If an employee has been exposed to someone with COVID and is sent home to work for 14 days, should we let the rest of the staff know?
If it's connected to the rest of the staff, and again, this is a time where transparency is kind of important. We want to communicate with each other, and if your employees think you're keeping a secret from them, they will be more upset. So I think if it's connected to the other employees and has anything to do with them, if they were in proximity with that, close and continuous proximity with that individual, then it would be worth a conversation. And in addition, I think it makes sense to also say the timeline. If somebody hadn't been in the office for a number of days and really didn't have symptoms or whatnot, and then, it depends on the timeline. So you don't want everyone to panic. You don't want to say, Jane Doe is positive and, everybody has to go home now. So look at each situation and break it down carefully.
I do not see any more questions. I see that Claire has answered some of them as we've gone along, so I don't want to double dip. I don't see any other new questions, Rachel, unless you do.
I see the FFCRA pay codes. We talked about that. I see some emails. If anyone's exposed, okay, we talked about that. Isolate area for 24 hours, then go back. Oh, Claire answered that in the chat. Isolate area for 24 hours, then go back and disinfect. Good practice to follow. No, it's a great point. If somebody, take a look at your cleanliness practices for your organization. What do you do in terms of cleaning? Is there something that you can boost? And this also helps the other employees feel confident and comfortable coming to work. So if they know that you are maintaining a clean environment and you've got hand sanitizers, you've got a cleaning crew coming in nightly, and you're taking steps to protect the employees, it goes a long way. So whenever there's a possible exposure, if you go in and clean the area, that will make a difference. I think some great questions this morning, and we'll maybe put together some forms, a grouping of forms and some information about them, and we can cover that.
Well, what I'm going to do, I know we went over the situations last week. There were a few folks that did not get the forms off of last week. So in addition to this presentation, once it is recorded in full and set up, I will send you this presentation in addition to the forms as far as the questionnaire to ask your employee as they come to work, as well as the form we are using from a payroll perspective to keep them, honest, so to speak, as far as why we're paying them and what we're paying them for. If everybody wants to go ahead and start dropping their email address into the chat box, I will capture all of those. Thank you.
All right, guys, thank you so much for joining us. We look forward to seeing you. We look forward to seeing you at all of our coffee breaks on Thursday mornings at 11:30. And please reach out to us. Know that CertaPay appreciates and values your business, and we are here for you. And let us know if we can help you with anything. Have a great day, everybody.